good morning. I am Dr Archana Pathak and I bring greetings to you from CK Birla Hospital. I am Director in Obs and Gynae at CK Birla Hospital. So today we are going to discuss about certain common menstrual problems in women. That is, we are going to start from the adolescent age group. So as we all understand, adolescence in today's times, it starts little early, say from 10 years in girls. So and at that point of time, many girls experience various kinds of menstrual problems in the form of they don't have periods for 2 to 3 months altogether, or when the periods come they don't stop sometimes, or they come very frequently, that is earlier than 20 or 21 days. So a normal menstrual cycle length varies from 21 to 35 days in a woman. So once the periods start either coming too frequently or they are coming late, everybody is worried. So in adolescence, for the initial I think 1.5 to 2 years, it is normal to have delayed periods. So please do not get alarmed if your daughter is having periods at irregular interval initially. So you don't have to approach a doctor immediately once she does not have periods on time, because the hormonal axis is getting prepared for the future. So it is absolutely normal to have little delayed cycles. But if your daughter is having frequent cycles earlier than 21 days, or if she is continuing to have periods which are not stopping, that is the time when you are supposed to contact a doctor. Also, when we have girls post-pubertal age group, you see in today's times when girls are sexually active early on in their lives, so one has to be very, very careful regarding contraceptive practices, because most common reason for missing periods could be a pregnancy. So one has to, if periods are delayed, one has to check for pregnancy and see the doctor immediately if there is any such problem. Also, there could be problems in the reproductive age group. The first and foremost thing which needs to be ruled out when a woman does not have periods on time is to exclude pregnancy and its various complications, like ectopic pregnancy, like maybe a pregnancy which was missed and resulted in an incomplete abortion and the patient keeps on bleeding. So all these things have to be kept in mind. There could be problems associated like a PCOS. If a woman is suffering from PCOS, she may have periods which are delayed, which are too early, or which are scanty, or which are coming every 2-3 months, but then when they come they don't stop. So all those problems can happen in the reproductive age group. So in this time period, whenever you have any menstrual problem, it is better to consult a doctor. Thyroid problem has to be ruled out, and the problem requires intervention as and when whatever factor is found to be the causative agent. So if it is a thyroid problem, then that has to be treated. If it is pregnancy and its related complications, that has to be taken care of. If it's a PCOS problem, then accordingly, if depending upon the whether the patient has completed her family or whether she is still planning, the treatment varies. So in all these conditions, you have to consult your doctor. Now there are times when a woman is experiencing perimenopause, meaning that she is not yet achieved menopause, that is that she has not stopped having periods, but she is going through irregular periods. That is the time period, say around 40s, early 40s to late 40s, and this is the time period when most of the women think whatever their experiences is because of menopause. But I'm going to tell you to be a little cautious at this point of time, because many kind of cancers, they can be missed if you are not going to contact the doctor on time. So if you are experiencing bleeding which is happening infrequently, also which is scanty, there is no cause of concern. But if your periods are coming late but they are continuing to happen, meaning the bleeding does not stop, that is the time when you should go to a doctor. Also, if you have periods which are coming too frequently, as I said, earlier than 21 days, even that is a condition which is not right and you should consult a doctor. Plus, if you're having intermenstrual bleeding, you're having periods on time, but in between your periods you have bleeding, even that is not normal. So all these symptoms are to be taken seriously, and you have to consult a gynecologist as and when this kind of thing happens. Increasingly it has been seen nowadays that women after achieving menopause, that means if you've had no periods for a period of about 1 year, it is okay. That is the time period which we consider as menopause. So once a woman starts having bleeding even after attaining menopause, that is after 1 year of complete stoppage of periods, that is the time when you're supposed to go to a doctor and do not consider maybe periods aa gaye honge. So this is not something to be taken lightly. You have to consult a doctor, a gynecologist, and take her advice. Go for an ultrasound, go for various things, a pelvic examination, which is very essential. So all these things need to be done to rule out that there is no such cause which is going to cause you problems later on in life. So we at CK Birla Hospital help you out in all these conditions. Whenever you want to consult us, please do contact us at CK Birla Hospital, West Punjabi Bagh. Thank you very much.